Hello everyone, I am Dr. Varun Agarwal, a consultant urologist, Uro-Oncologist, laparoscopic and robotic surgeon. Today we are going to speak about bladder cancer, that means the part of the urinary tract which stores the urine, cancer of that part. It's called bladder cancer. So bladder cancer is the 10th most common cancer in the world. It is spreading quite rapidly. Even in India, the incidence of bladder cancer is increasing rapidly now. What causes exactly bladder cancer? There are multiple causes as mentioned in various books. The commonest one is smoking and tobacco. People who are more used to smoking, tobacco chewing, they are more prone to bladder cancer. Secondly, people who are working in certain types of industries, that means where there is exposure to paints, different types of dyes, rubber, even metallic and textile industries or leather industries, they are more prone to developing a cancer in their urinary bladder. Sometimes there may be a family history of bladder cancer. Even such people are more prone to the same. Apart from this, the genetics of the body, the chromosomes of the body, if there is any problem with one of them, it can also lead to cancer of the bladder. Apart from this, there can be a long-standing irritation in the bladder, irritation in the form of chronic infection, that means long-standing infection. Certain types of infections like schistosomiasis is one such infection. It can lead to cancer of the urinary bladder. It is quite common in Africa, Egypt and in those countries, and it has led to a lot of deaths as well. There can be catheterization for a long time. That means a catheter is a tube which is placed in the bladder. If there are many patients who require catheter for a very long period, they are also more prone to such cancers. Similarly, stones in the bladder are also a risk factor for cancer of the bladder. These were in general the causes of cancer of the bladder. What exactly is it? Abnormal growth of some cells inside the bladder, it leads to a tumor. Usually any kind of tumor in the bladder is a cancer. Very rarely, only 0.1 to 0.5% times, a tumor inside the bladder may be not cancerous. Otherwise, usually a tumor is almost always cancerous. Now, how will you know that if you have a tumor or a cancer in the bladder? The most common presenting symptom or sign when the patient comes to us, he says that I've got blood in my urine. He may pass some clots in his urine, or he may have blood in his entire urinary stream. In fact, in very late stages, they may have a lot of pain in the lower part of their abdomen, pain while passing urine, or when the cancer is spread in the body, they may have pain and aches in different parts of the body, along with weight loss and decreased appetite. How do we diagnose it? Patient presenting with these complaints, as I mentioned, we first do a sonography of the abdomen. Sonography is done which shows the tumor in the bladder. We confirm it by doing a CT scan. A CT scan tells us the exact location and size and extent of the tumor and how much it has spread. If we want to see how much it has spread in the body, we may also call for a PET scan. These are the small basic investigations that are done. Now, how do we treat it? For treatment, first and foremost, we have to have a diagnosis that this is surely bladder cancer. So how do we diagnose it? We take a cystoscope. That means we put a camera from the urinary passage of the patient and we remove the tumor from the bladder. After removing the tumor, it is sent for a biopsy. That means it is examined under the microscope by a pathologist, and a pathologist tells us what kind of cancer is it. Is it actually cancer, or how deep it has gone inside the bladder? These are a few things a pathologist tells us. Based on these, we decide the further treatment. So the first part is removal of the tumor by a cystoscope or a camera which is put in the urinary bladder. In this, there is no incision on the body, no cut on the body, and based on the report of the pathologist, we decide the further treatment. Now, what are the types of further treatment? It depends on how deep the tumor has gone in the bladder. If it is quite superficial, not very deep, then we just put a medicine in the bladder. It's called BCG, a medicine called as BCG. It is put in the bladder in 6 cycles, once a week for 6 weeks, and then it has got a maintenance regimen also. This is only when the tumor has not gone very deep. Suppose if the tumor goes very deep in the bladder, which is told to us by a pathologist, then the patient may have to undergo chemotherapy followed by a surgery. So chemotherapy and surgery are reserved for patients in whom the cancer is spread down quite deep into the bladder. If the cancer has spread in the body, suppose if it has gone to different parts of the body, then the patient only has to undergo chemotherapy usually. Now, when I speak about surgery of bladder removal, there are three types of surgery, three ways in which the surgery can be done. It can either be done by an open technique, that means you take an incision on the body, a cut will come on the body, and wherein the surgeon puts his hand inside the body and does the surgery. So it involves a big cut. Obviously the pain after the surgery is more. Next type of surgery is a laparoscopic surgery, which is done with the help of a laparoscope. That means 3 to 4 holes are made in the body and our instruments pass through it and the bladder is removed. Finally, the latest advancement is a robotic surgery, wherein a robot is used, and with the help of a robot the entire bladder is removed. The robot has the added advantages of very good vision during surgery and lesser blood loss and increased precision during surgery. So these were the treatment methods. I have covered them in quite short. I mean, there are a lot more details which we consider while treating a patient for bladder cancer. Tried to cover as much as possible, and I hope I have made myself very clear. In case there are any more doubts, any more questions regarding the same, or if you are having any blood in urine, please feel free to consult a Uro-Oncologist. Thank you so much.